This is the Down to Learn podcast episode 1, and we're live on it. So, thank you again, Nkamo, for doing this. And as usual, it's just going to be a conversation about everything and anything. But particularly because of your job, I'm particularly interested in the way you got in, how you got in, how is it, and particularly in these times, how you're managing. Because it's rough, man.
I know. I think, before I get to how I'm managing at these times, I think more than anything else, the fact that I have a job is what's pushing me.
Yeah.
Because there's a lot of people on top of me that are sitting there, and then there's next nothing there. So the fact that I have a job, no matter how stressful it may get, will always say, get up and go so you can get paid. Some people can't get up and go anyway, so that they don't want to. There's nowhere to go up to get up and go to. So that's what's helping me through such a time, because you need to focus on the positives. You need to have a positive mindset, and we got this mindset. There's always casualties in there. You cannot have casualties in there. You can't. So you need to put your mind at ease and say, you know what, we're gonna make this. We being maybe, let's say, human race as a collective, and not we including yourself as an individual. So maybe if you say we as humanity we're gonna make it, I may be the casualty. But you have to be okay with it. You have to keep a strong mind, because waking up and going into a place of work in these times that's centered to the whole virus, it's a problem.
Yeah.
To say the least, it's a problem. Personally, I'd rather not wake up. But then again, you have to work in order to get paid. So
it's just unfortunate that this particular disaster requires your particular kind of.
Yeah. No, listen. I feel like we all having our peaks in industries, For the time there was little to no usage of gasoline and oil. The markets also crumbled. They broke, essentially. So the guys that are then in trading and all that, they were having a problem of their own democracy, as opposed to people in the medical field. When we're having a pandemic, then it's a problem of them, and then you guys are having markets that crash. Well, in this instance, it's because of one, it's because of the other thing or the other aspect of this discussion. But say maybe one day, I don't know, something happened in the markets, not COVID or something, but something happened in the market, they collapse. You're having a bad day. Yeah, you understand? This is not COVID related, so you come into the medical field in this. So then you have your own episode, and the rest of the world unfortunately can't help, which is what's happening now. The rest of the world can't help the medical field, but they can sit there and wait. How does a call center help hospital in times like these?
So everyone is doing that.
Yeah, some jobs aren't able to assist you. The risk analysis and analytics will probably have a chance of saying no, because this has been introduced. We can help you guys and say there's this risk, this much risk, and so forth going forward. But other industries can't help you. In your crisis, other industries can help you. Exactly. If you are a traffic officer and you're having a busy night, you're having a busy night at a concert or something, you understand? That's your field. You are a traffic officer. So where there's traffic, you have to officiate. Right? And then when you're having a bad night like huge concert, you can get police officers. They come, they help you officiate. So there are some people that will be able to do that, but you can't get something like kidding. Military to come officiate. You can because they have their officers as well, but like you can't get a detective, so to say, come direct traffic. You understand? It's not aligned, so to say. So in this instance, the medical field is not on its own, but it's limited. Not everyone can help. Like in 2008, what could the medical field do for the collapsing markets? It's not like we could say, okay, fine, we'll admit you guys and then fine, the market will be okay. No, can't perform a drug or anything to fix the markets.
So, in other words, it's a matter of saying, you know, you have a draft, but also, as much as a lot of people want to chip in, it's hard to find.
Some of them can't.
It's a lot for them to chip in through, you know what I mean? Like a way for them to, because you are what's the assistant pharmacist?
Yeah.
And that's the assistant. So you work with, like, on a day-to-day basis. I'm sure you've seen a difference. Okay, I'm assuming,
yes,
but I'm sure that you've seen a difference as to the way you operate pre-COVID versus post-COVID.
I can tell you now. You will see the difference even if you don't pay attention to it. It's so big. It's so big. That's the smallest of things, you know. We always have a queue here sign. Do you understand?
Yes.
And then people still move past it and say, this hatch looks like I could ask a question here. You know, it's not the help desk, but it's a desk nonetheless, and there's somebody here with a computer, so it looks like I can ask a question here. Certainly, where do I 1, 2, and 3? You know, you could stand anywhere. Now, you can't stand anywhere. You know, you have to, when it says queue here, you have to queue here and be 1.5 meters away from somebody at least. So, you take a look at pre-COVID, and then such things were really unnecessary. Somebody would come with a trolley, somebody would come with a basket, somebody would come with a handbag, you know. Distance between you and the next person was always fluctuating because one has a bigger object in between them. Now, whether there's an object or not, you have to be at least this far away. And that's just looking at the queuing side in front. And then when it comes to like the inside, you know, you have pharmacist and pharmacist assistants and the likes working in call centers. You know, you went from having say a medical aid with 150 call center agents working every day to a medical aid with 50 call center agents working, because you have to be at least 1.5 meters away from the next person. And then you get some call centers are just within a 4 square meter radius. There's literally a person per square meter, because it's all, each and every corner has a little cubicle that people are just plugged in, and there's a phone and a computer. That's it. You don't need a bigger space than that. So now, because it's not 1.5 meters from 3 other people, your workforce has to be cut by 3. You need to make sure that each cubicle has 1 person, because distance allows only 1 person. And now you get medical aids like operating with half staff and stuff from home and all that. And then you look at, say, in a retail outlet. You look at a retail outlet, and you no longer see as many patients. And at least now the patients have ordered. You understand? At first it used to be there's a queue and somebody will pass everybody and come ask, do you guys have 1, 2, and 3? But no, man, you follow the queue. You know, you have to follow the queue, and then you can. I just want to ask nothing more. I just want to ask if you have.
None of that anymore.
Yeah, none of that anymore. Whether you want to ask or not, or we don't even have askers anymore. We don't even have askers anymore. You know? People
just get into the store to ask a question.
Know what they want. They know where to get it. They may ask for directions, but they won't come and say, do you keep 1, 2, and 3? They'd probably call beforehand to make sure, so that they don't spend unnecessary time moving between places. So,
do you think there's less people in retail? Because I know there's been news about a lot of people not going to the hospital because they fear getting COVID.
Oh, yes.
So is there, like, do you see any of that in the pharmacy?
Yeah, you see that there are people let's say in our country, we are about today 105 or so of lockdown. There are people in the country who have literally gone out, say 3 times in that whole time. Literally gone out and saw other people 3 times in like over 100 days.
Mm-hmm.
There are people who are that reserved. And then you get that these people are on chronic medication that they have to take every month.
Yeah.
And they don't have 100 days worth of medication. 100 days is about 3 months. Ever since they announced the first day of lockdown, somebody has gone out only 3 times to get essentials. And not once would that person think I'm going to a retail outlet for medication, because that's where COVID patient would get their medication. So that's where we most likely encounter. And yet people defaulting on their medication because they are afraid to go. And then you get somebody with high blood pressure defaulting on high blood pressure medication because they are afraid to go because they have a comorbidity, which is high blood pressure, so they're at higher risk. And then you try and send somebody, they're afraid to go because there might be somebody with COVID there. So I don't want to catch it. And then if I catch it and bring it home to you, it's either way.
So even deliveries to the patients is difficult.
No, that's when I was getting to that. Okay. So this is the beginning now of lockdown. Right?
Yes.
So now people haven't gotten their meds in like 2 months, and now we didn't have travel. You know, we were all under lockdown. We all understood lockdown. You had to have a permit to be on the road. And it took a while for deliveries to actually get permits, especially food and little parcel deliveries, to understand. It wasn't a problem for like delivery of medication or things like that, but you understand the truck that delivers clothes to retail outlets wasn't as effective, so it didn't get permits. You know? Who are you delivering clothes to because the stores are closed? So then I think the country or the government then came with ways to implement safety measures to ensure deliveries can happen, and that's when deliveries then went back to say you can deliver to your doorstep. But then you find customers who say, okay, fine, you can deliver to my doorstep, but you are a deliverer from this company, you know, or this pharmaceutical outlet. Mm-hmm. Meaning, say you deliver meds from your local pharmacy to 18 people a day. Do you understand? Mm-hmm. And you have that one with the paranoia that means today this guy has seen 18 other people. Mm-hmm. So chances are I would have been safer if I went there and I found 4 people in line, because I would only be in contact with 4 people. Mm-hmm. But then this person is in contact with 18 people in one day who are each at minimum interacting with at least one other person. Mm. So from 18 now we are on 36. Do you understand? So me having this one delivery because I'm afraid to go to the shop and interact with 4 people or get in close range with 4 people means I'm getting in close range with somebody who's gotten in close range with 18 other people who have gotten in close range. So it's now a pyramid. Mm. So you get people who just say, you know what, I'm not calling anybody here. I'm not going out. I'm literally staying in. That's it. So people say, I'm not getting vacation. I'm staying in. Just to avoid contracting. And for some reason, you have to understand these are people with comorbidities. Mm. So they're afraid that if I get it, I'm gone.
But also at the same time, it's those same comorbidities that need the medication that avoiding to take because they're afraid to.
Your blood pressure can go out of control and kill you. Or you can go and get your blood pressure medication so blood pressure doesn't kill you, but you get COVID and COVID kills you.
Because of blood pressure.
Because you have blood pressure. So it's a gamble, and people are gambling with their lives. You know, I think that's what people are angry. They want to gamble with their own lives, unlike the government gambling on their behalf, saying you can go out this week, or stay in next week, or go out this week. They have to sit there and say, I decide not to go out. That's my gamble. Because I always say it's better to regret your own mistake than a mistake that somebody else made for you. Of course. Yeah. So now.
So do you think there's a way, around this? Because the problem is, I can't go to the store because I can't go. I don't want to go to the store because I'm exposing myself to COVID and in the environment.
Yes.
At the same time, I don't want someone to deliver to me because if that person is delivering to me, I don't know how many people it's been delivering to, which means I don't know how many people it's been in contact with. So I'm not gonna get in contact with that delivery. I'm not gonna get into contact with anyone at the store. So, is there a way I can get my medication? Like maybe like couriering the medication.
Yeah, but at some point of the courier, you're gonna have to have a human there. You're gonna have to have a physical able body. Otherwise, how do you get a parcel from? How do you transport a parcel from one place to another? Who's loading it in the truck? Who's unloading it? And then who's driving it to that place?
Because I think one way, it's, but also the question also is a matter of like, what do you regard as close contact? You know what I mean? That's also a very
I think close contact would be, I don't want to touch something that's touched by somebody else.
Yeah, that's very, you can literally say that about food.
Yes, but that's the same thing about medication.
Yes.
You understand? Some point it's touched by somebody for it going from the company that manufactures to your doorstep, you can't have, I don't think there's a way around it. It has to pass through human hands.
Yes.
There's no
either through delivery
or manufacturing.
Because it seems like the way you're saying it is those people imagine as if from the day it's manufactured or the day it's piped, from the day it starts being manufactured. Because it's a different case in the beginning of COVID, because in the beginning of COVID we're using stock pre-COVID, before COVID with that. Yeah. Now we're using stock. You can even argue that it was worse then, because now the production services have more stricter rules and everything.
Yes.
But the question is, from the start from the start when, let's say, take an example of Panadol. Okay, a chronic medication for, what's a chronic medication?
Okay, let's say vitamin C. Vitamin C, something, let's say a tablet that contains vitamin C.
Oh yes, just to boost the immune system.
Yes.
Yeah.
They're making it back then, and they're making it now.
Yes.
Okay, I'm going to explain it this way. It shouldn't be any different.
What do you mean it shouldn't be any different?
The making of a tablet back then and the making of a tablet now should not have changed even once. Because there are rules that state that something has to be produced in a certain environment to make sure that there's no contamination whatsoever. Of course, right? Even in a factory, it's inside a factory, but it's not an open factory. Understand? There's ceilings, there's special rooms and incubators within there to say, okay, this is where we store the raw vitamin C or a raw flour, which is an ingredient. It's enclosed. It's physically sealed, even from air, because that air particle could be contaminated. Yeah, could be contaminated. So that the process was there before COVID, because you have to make sure that from the time a tablet is made up until it's in a blister pack, that air that's in a blister pack must be as pure as possible. Okay. So prior COVID, even after COVID, nothing in the purity of the product has changed. It still has to remain there. Sure.
Okay, so from now from tablet to being in the packaging, the silver packaging that holds the pill, we can. You don't expect someone to be touching it.
So you don't know it.
Yes. So the silver packaging, even then, it's just clamped and probably put in a box or something like that.
It's the tablet making scheme or cycle hasn't changed. Maybe the person who's now overseeing, because now there's a rumor that it may be airborne. The person who's overseeing that, those factory faults, one or two loose tablets that always fall on the ground. You understand that somebody would be like, because machines are, and then in a little jam here and there. And then, so for that split second or delay, that there's a power failure and then it moves off by a millimeter or a centimeter. Then that whole batch is stripped. So the person who then oversees that would probably then have a mask or have protection that they did not have prior COVID. But other than that, the tablet itself, the making, shouldn't change.
What about the packaging?
The packaging.
Because I think that's the most important part.
I think now the package. You can't change packaging that quickly. You can, but there are some items are slow movers elsewhere. So let's say this medication has expiry dates, right?
Yes.
Some as short as a week, some as long as a decade. Yeah. There's a certain food that's like a decade, 10 years. You look at it's standard. It will expire 10 years from the year you are selling it. Do you understand? So
it's not very surprising because medication usually comes from like plants.
So it's something that's been preserved for years.
Exactly.
So you can also still keep it for years. So you take a look at that. You think, okay, fine. For the next 10 years, there's gonna be this package available, which is in loose tablets. We've created a batch that could, in theory, last the whole 10 years. So some pharmacies, let's say it comes in a box of 5,000, and some pharmacies use 30 a month. They have 10 years to finish it. Some pharmacies use 4,000 a month. So every month they're buying a new box. So they also have 10 years to finish it, but they won't get to 10 years. So if you change or alter the packaging of your product, that smaller pharmacy that uses 30 a month, still in theory a stock of something that comes in loose tablets for 10 years. And then this one that uses 4,000 a month, if they buy one box a month, as though it can last 10 years, it only lasts like a month. So now, they would get the new packaging before that other company. The company only needed 10 years from now because that product will not expire. So you cannot deem it faulty because when it was made, it was the same way it is. So that's why package changing would be a problem because now you're going to get a patient who this month will go to that other pharmacy and get loose. Next month come to this pharmacy and gets a blister pack. And then the third month goes back to that other pharmacy and then it's loose and be like, one of you is giving me a fake product. Do you understand? Because it comes in different. So you have that, and from the consumer's point of view, you do not want that. Like as a consumer, I don't want that panic to think somebody's giving me something incorrect that could harm my health. So it takes a while for a company to then say, we are changing packaging. It does happen, but I think it will take a while. And also consumer-wise, we'll be very wary to say, I bought a MacBook last week from you. It had an Apple. I bought it had an Apple logo. And then next week it has a logo. And then or a pear logo. And the other week I come back Apple. I bought something else, and then I see a banana. So what's going on? Which one is the original?
So in that way, you're saying that a lot of things are still packaged the same. It's just that some pharmacies still have stock for like a lot of things pre-COVID because firstly the medication lasts and secondly they don't go through the medication as fast as say a big pharmacy where they know that people who just come here and buy 10 things every month, every day that you know this stock, so they have to go through a lot more stock where packaging they have to buy more from freshly packaged things if you understand that. So in terms of the handling of the packaging, do you think there's a lot of hands that go through the handling of the packaging? Because I think the question is, can we start from tablet making to the day it's on the shelf at say discount and say how many hands touch this thing? Because if you cannot avoid hands, then it's not you can't really run away that the delivery guy also is an extra person because it's an unavoidable thing. In a way,
okay.
Or is it?
Let me say this. The first hands that should initially touch a tablet should packaging. No, like you understand what I'm saying.
Okay.
The first hand that should literally touch a tablet should be the person who's going to put it in the mouth.
Okay.
You understand?
Yes.
This is the final step.
Yes.
The first person to touch a tablet should be that person.
Yes.
You understand? Even say, let's take it a step before that, before manufacturing at a pharmacy. There's a counting tray that you use. So you take the bulk, you throw it on the counting tray, you use a spatula, you count out, you throw the bulk back in, you open your packet, you throw the tablets in the packet, zip lock it,
yeah,
or tie it,
I've seen that.
but you don't touch the tablet.
So that's an actual conscious thing that do not handle it. Yes. So even pre-COVID it was that way.
Yeah. So now the first person to then touch the tablet would be you who was going to drink it, because you're going to open the packaging, then put your finger inside and take it out. We have the assistance of a counting tray. So if you put extra, you pour on the counting tray, count the extra out, and then you pour back. So you don't necessarily touch the tablet.
Yes.
And then then you can go like 4 or 5 steps higher. During manufacturing a batch from the main batch, let's say I made 1,000 tablets. Then I'll take 100 tablets, go for testing, for evaluation, for screening, for whatnot, right? And then give you a percentage of maybe 7 out of, let's say 9 out of 10 tablets are effective. So 90% of the 1,000 tablets, meaning 900 out of 1,000 tablets are safe to drink. So I can give you that, or I can say they're strong. So I can give you an overall view of how it is in terms of that batch. Yes. But the 100 that I took out can't go back into that batch. Those are my test subjects.
Yeah.
So
it's just like,
so they never end up in somebody's mouth. That's what I'm saying. So then from the,
it's like when you're making a pie, or when you're tasting making a stew or something, and you're tasting. Once you taste it and put it in your mouth, you don't spit it back.
Yeah, you don't put it back out. You understand? So you tasted, nope, I need more salt.
Yes,
that stage is already gone. Yeah,
you know what this batch represents.
Yes. So that's the same principle. So the first person to touch a tablet with their hands should be the person who's drinking it.
Yes.
So that's something that hasn't changed, even post COVID. So I don't think much on our side has changed, or in theory and practical should change.
Yes, because
we should.
Your business from the beginning.
Yeah.
Before this, clean your hands and everything. Your businesses
should have already been cleaning hands and all that.
Yes.
And yeah, I'm proud to say we've had training on hand hygiene even prior COVID and all that, because things we learn as you go, and we've had Ebola before, we've had the H1N1 flu outbreak before, we've had swine flu outbreak, we've had bird flu outbreak. So you learn all these processes and then you implement them, and then something like COVID comes along. It's a virus that behaves like other viruses at some point. So because we've had other viruses, we have now a protocol that's in place. Wash your hands frequently. So now there's a COVID-19, which is a virus, behaves like other viruses. We should, in theory, already be washing our hands frequently. So maybe protective equipment would be different. We didn't used to work with masks. In some sectors, we didn't used to work with gloves. Because you don't touch the product per se.
Yeah, you don't need gloves in the first place.
But imagine, say, in a hospital setup as opposed to a retail. There's a patient in a room with the COVID medication, coughing and all that, right? They're not coughing directly on the medication, but they're coughing on the packaging. And then what used to happen is when you get it as a credit or sort of return and not used before COVID, you still take it, open the packets, and then pack it properly, with your bare hands. Now you think there was a COVID patient, so that could initially pass it on to me, so then I have to wear gloves. There's some then jobs that are now you have to wear gloves. But if you check the protective equipment a doctor would have worn while operating theater, and what they're wearing now around a COVID patient, they're the same. So for a doctor, they didn't change. Is that maybe for a nurse, because now a nurse that's in a normal ward would then dress like a nurse that's in a theater. So that would change.
So there's more, what is this? It's a bit more cautious approach.
Yes.
Like it's already a cautious industry.
Yes, it's already a cautious.
They even add an extra layer.
Yeah, they just add an extra layers, and they're rolling out the precautions of other sectors on other sectors where it wasn't necessarily applicable at that time. Because you had a ward that would say, we deal with short people. You understand? We don't deal with anything else in this world. We just deal with short people. That's it. Our main aim is short people. And then now we don't dress somehow. We don't put on gloves. We don't do anything because we just deal with short people. Now you get told that within short people, some of them have a virus. So you're gonna start wearing gloves, start wearing so. But there are other wards who deal with viruses only, that were wearing those gloves. So they're rolling out that whole protective gear out there to other people who didn't need it at first. Yeah. But initially, we have to have been prepared for a virus or a virus outbreak or a flu outbreak or any form of disease outbreak. We should technically, in theory, have a sector that's already actively protecting against that.
And do you think what's this? Because you explained how the protective measures in making it, the protective measures in packaging it, the protective measures in even handling the whole thing. And even especially now, with the knowledge of past experiences and the knowledge of how serious this thing, this COVID thing can be, there's even an extra layer of protection. Do you think a delivery driver adds that much more risk to the thing due to exposure to other people? Because
personally, I'd say my own personal opinion. I'd say that I wouldn't think if a person is following the correct PPE measures, I don't think that person, even if they are COVID positive, if they follow the correct PPE measure, you are not a danger to the next person. If I'm COVID positive, and then according to the studies and the knowledge that's out there, it passes through bodily fluids. On a day-to-day basis, I don't exchange bodily fluids with everyone. As it is. I don't, maybe my partner at home or something, but I don't exchange it with anyone or everyone. So, if I come and I wear gloves and I wear a mask and I wear a visor and keep my whole body protected and make sure my sweat doesn't go and splatter everywhere. If I put on all that outfit, that gear, that gown and whatnot, and work my normal job, I shouldn't pass it through to the next one. So it shouldn't be, it should just be a normality. So saying a driver then would because be an added risk. But like I said, the first person to touch the tablet you drink is you. So the driver doesn't touch, they'll touch the box on the outside, like they've been touching all along. Then it gets to the person that's in the pharmacy who unpacks it. And then that person is required to wash their hands every hour, at least minimum, or every 2 hours, or as often as possible. They do that, your tablet packet and tablet itself will never be contaminated. So the delivery process, having a driver does not add risk.
Or that much risk.
Yeah, it's down to how careless a person is. That's why you still have DUI cases. But you still have, in existence, of course, because you're not supposed to drive under influence. Yes, but you still have people getting arrested for driving under influence. You understand? So the negligence of a person would be the risk factor. But if they were all following principle, do not drive under influence, we'll all be fine.
So you would say that
driving under influence would not exist.
So you would say that getting medication delivered to you if you are really at risk and afraid is the best form. Yeah. Because there's no argument that going to the store is that you don't know who you're exposing yourself to.
Yeah, but also,
at least here you're exposing yourself to someone who follows regular things and is cleaning and everything.
Yeah, so they'd be safer than you are if you're not following the correct precautions. But what I'm saying is, no matter how close you can be to a person, if you and the person are following the same precautions, you will never be at risk.
Because at worst, I'm thinking is that fine, you have the packaging. Firstly, the packaging doesn't come like they don't just bring you the box. They bring your box in a plastic bag.
Yeah.
So the worst, like with Uber, I think with Uber services, you can actually have an option where like leave it at the door and leave, and then I'll come and collect it.
Yeah.
So you never see that person. So what you see, the first thing is the plastic bag. What you do is take the thing out of the plastic bag, throw the plastic bag away, wash your hands, and any contamination is basically gone there.
Yeah.
And if you're still worried, you open the box of the packaging and take out the silver thing, and then throw the box away and you wash your hands. There, from the manufacturer, they make sure that hands do not touch that thing in the first place. And even if you're worried about air, then you open the peel. What's this? You take you drop in something. Exactly. You know what I mean? It was airtight then,
So, like I said, initially you can go from what I believe if both parties involved, one that's positive or negative, weigh the necessary precautions that are needed, then it would not be unsafe. It's the same thing as if a condom would work 100%, and then two people are using it. One is positive with STD and one isn't. If they use the condom and the condom is 100% effective, there will never be transaction. Do you understand? Yes. So they both use the correct measures, so there'll never be a transition from one party to the other. So it's the same with COVID. If you protect yourself and the next person protects themselves, it will not be able to transition from one party to the other. So basically what I'm saying is that if both parties are fully protected, there should not be a problem. Which is what the government is trying to regulate, that people are taking full precautionary measures. And if that's done and followed, then there will in no way be transmission. But
you just hope that because people are dying, and you cannot neglect the fear of someone with a comorbidity to this thing. But you can also hope that they can have some hope in the delivery system, in the handling, in the packaging and the handling of the thing by the pharmacy, the system, the structure that's in place. You can hope that they have enough faith in that to consider that it may be worse to not get the medication than it is to get it, because a lot of people are hard at work trying to make sure that they can get the medication and get it safely without being without basically the virus being transferred to them, basically. But it's contract. Contract.
Busy with the transact. Like, no, it does not sound correct. But I think it's safe to say that let's say I'm starting a school, right? And then I'm having a rule book of rules to follow, right? Why is it that I haven't had a learner, I haven't had a teacher, I haven't had anyone at that new school, but I'm already writing down as part of the rules the consequences of not following the rules? Understand? Essentially, when I put down rules, the only option is follow the rules. Understand? That's why it's a rule. The only option is follow that rule. Now, why is it that I then say, if you don't follow this rule, I'll do 1, 2, and 3? When because it's a rule, the only option is actually following that rule.
No, I think it's
because you will always have rebels.
Yes, how do you say that?
That's how the virus is still, it's still spreading. Because From what I read, it's active in your body for a certain period of time. Do you understand? And after that period of time, you can't then pass it to somebody else. So let's say everybody in the country were to sit still for that period of time. Initially, it would die out.
Yeah.
Because it can't pass from one person to the other. So it can't keep rotating.
Yeah.
Right? And that's how it also mutates, because from my genes to yours, you might be looking younger because of 1 or 2 something in there. So it will say, okay, fine, let me calculate this. And then for the next person, it will attack them even though they look younger, have a younger immune system.
It's sort of like it learns from.
Yeah, it learns from. It's a virus. It learns, it changes, and it tries to counteract you counteracting it.
Which I think that's a very good point, because I was watching I don't remember what it was, but they were talking basically about the difficulty about having a vaccine. I think it was a podcast. Yeah, I think it was a Joe Rogan podcast with an epidemiologist, like one of the top epidemiologists in the world, and he was saying the Zoogster virus, there's still no vaccine for it, not because people don't understand what it is, it's because they understand it, just that the one in 2020 is a bit different from the one in 2013 or 2015, because
the strain
is a bit different because it mutates and it almost becomes something entirely different because it moves from one subject from another and all those. So that's also another difficulty, I'm sure, with developing the vaccine for this. That
by the time a vaccine for the initial strain comes out, the virus would have mutated. Right?
Hopefully not as much, but
but that's what the person was essentially saying that on podcast, and I think you meant to say the Zika virus, not Zoogster. It's the Zika virus.
I don't know what
but you understand that let's say somebody brought it into the country. It's active for 14 or 20 days. It's active for 20 days in a host. After that, it dies out, or you can't transmit it to another person. Right? If the whole country was to sit still for 20 days, even if 18 people have it, it will die out, because then after 20 days, you can't transfer it to anybody else if you have it. You understand? It's now become weak. So it's now. What's this? It has now genetically modified to your body and can't move to another host, because it's already got your cells, your DNA, your structure.
You mean like after you've recovered from it?
Yeah. No. I'm not talking about recovery per se. It enters your body, and then in let's say 20 days, it now is unable to leave your body because it's now accustomed to your body. Do you understand?
Does that mean it's untransferable?
Yes.
Really?
Yes.
This particular virus or just viruses?
No, I can't say it because I don't have that much knowledge, but that's essentially how, it's not all viruses, because
of course, different.
You've got that other 3-letter virus that
of
you
course.
can have it for 13 years and still pass it.
Yeah.
You can have it for 1 day and still pass it.
So are you talking particularly about influenza right now? That when you say, because COVID
I was talking about HIV actually.
No, I mean like what's this types of viruses? Because I get HIV and COVID. They're both viruses, but they're different types of viruses.
Yes, influenza as well.
So COVID falls part of the influenza family, in a way.
In a way.
Not in a way. It's actually it's sort of an influenza because it's likened to the Spanish influenza. Not the way it's genetically made, but the way it transfers. Because it's a family. It's a family of viruses.
So the HIV is one virus that doesn't get accustomed to a host. So it will then be transferable to 1 or 2 or a million other hosts.
So that's a whole different type of virus.
And then the COVID virus then after a certain amount of time, your body either kills it out, or for some other reason, maybe it's accustomed to your body and can't live outside of your own body because it's genetically now modified to your body. So you can't pass it to somebody else. But for one or the other reason, so my highlight here was for one or the other reason, if the whole country were to sit still for 14 days, it would not be transferable to another class, to another class.
Okay.
So meaning we will all be healed. Even those who had it but didn't know, if they sit still for 14 days, they don't have it anymore. Do you understand?
So that's why that 14-day quarantine period.
Yes, but even so, they knew that you can't. That's the idea, but it can't happen because some people's jobs require them to travel on a daily basis. You have people in fields that require seeing people or markets,
and it's unavoidable.
Yes, it's
like
unavoidable.
A surgeon.
Yeah.
Like,
there are people who are sick every day, so you have to attend to sick people every day.
Yes.
You understand? So you can't say, okay, for the next 21 days, nobody be sick, and we're all gonna understand stuff.
It's not possible.
So it's not possible. Unless you're saying, you know what, even those who have heart attacks and all that, for the next 21 days, you just turn a blind eye. And that's inhumane. You can't do that. So the general idea is if you're all to sit still or isolate, not get in contact, if the whole country were even moving to your day-to-day duties, but the whole country were to not be in contact with any or other party in 21 days, the virus would die out. If the whole world were to not touch another human being for 21 days, this whole pandemic falls away.
But
do you understand how easy this thing could be? But also, yes, it's usually, this is simple. You can move in and about stores and whatnot. Don't touch anyone for 21 days. You've been alive for 30, you've been alive for 60, you've been alive for 14, you've been alive for some. Just 21 days. Don't touch it.
But the problem is that, like you said earlier, like you alluded to earlier, this research coming out that says now it could be airborne.
Yes.
Like someone's like, I'll chew in the air, and then you just walk into that I'll chew.
No, but what I'm saying is, you have PPE, right?
Yes.
If you had chew, you cannot chew in the air if you have a mask on and the visor. That's what that would say.
That's the point of that thing.
Yes. But now, you can chew while kissing somebody. And whatever you take out when you chew, you pass on while kissing, which is saliva. Do you understand?
Of course.
And droplets of
saliva.
Yes. So essentially, the whole country or the whole world put on a mask for 21 days and a visor for 21 days. Don't get in contact with any other person. Like, if I have a mask and a visor and gloves on, and I'm packing the food on the shelf, if you have a mask and a visor and gloves on, and you're taking the food from the shelf and going to the till, there's no contact of our body fluids. Understand?
But like you said, what's this?
The problem is the rebels.
But also those who are forced that contact.
Yeah, and also those who forget, How many times do you leave the house and you forgot your mask?
Hey, but now you realize that I can't go anywhere without that mask.
Yeah, but you now a number of times forget that mask or something. So if you were to remove, theoretically speaking, it's possible to have this virus gone and forgotten the next 14 days. Theoretically speaking, people follow instructions: gloves, mask, visor, or gown and everything. Just make sure your body fluids aren't transferred to another being. Understand? That's it. That's all you have to do for 21 days and then go. Then now you start thinking about people who are living in the same household. And there's 5 of them. They're using the same bath, using the same toilet, using the same tray, using the same teaspoon utensils. Do you understand? So there's no way that bodily fluids will not exchange.
And it's funny that.
But also, if you think about it, if they don't move for 21 days and they just stay within their family confinements, it stays there for 21 days and then still dies out.
And also, the problem is that works if everyone is in exactly the same situation, exactly the same household, have exactly the same access to facilities, resources that can help them stay there 21 days. While the reality is that some people, if they stay in their house for 3 days, they will starve.
Yeah.
Some people, if they don't go to work, they will get fired because their work requires them to come to work and touch other humans on a daily basis. Now, of course, nowadays, US is trying to be safety measures and stuff like that. But like you said, they are in danger of being exposed to the reckless ones, the rebels, the ones who don't care. Like, I mean, some people just go to like jobs as like a cashier, like something, because you complain that people complain that hey, shops are not open, PKM is not open. Okay, if they open Pick and Pay, they will have to have cashiers, they will have to have all these people, and there are people just coming to the stores and shouting that I don't want to wear a mask, hey, I don't want to do this, and they are being exposed to these reckless people, and that's the problem that. This thing it's hard to contain it this way.
Essentially, it's hard to contain because there will always be somebody who doesn't follow the rules. That goes back to my example about opening a school. If you make a school rule book of saying wear your uniform at all times, and then you say we're gonna have a point system and it's minus 10 points for every day you don't wear a uniform, it means that there will be a day that somebody doesn't wear a uniform for one or the other reason. You understand?
What's this?
So
history of humans, we know that this
it's the same with the disease, the virus. There are people who aren't gonna be wearing masks. There are people who aren't gonna be following rules, and that's that on that. And by the time you have to then think, okay, fine, there are people who are not gonna listen. So how do we do it then? So sometimes you get Magogo who doesn't even know about masks because she can't hear anymore. So she hasn't been listening to radio. She lives in the rural areas where the sun from a place that's populated more than the rural areas will travel every week. And if they contract the virus, it passes on to the next person, to the next person, to the next person.
Even if they do a mask, like what's this? They don't have the type of money to go buy cloth masks and surgical masks that 100 rand. So their 100 rand goes like
So essentially, if we lived in a perfect world where everybody had the same conditions, the same health, the same resources,
basically everyone had the same
life. Yeah, everybody had the same life.
Because another thing
21 days we could get rid of the virus, but now because we don't have the same life, we have people who have to use taxis, people have to use cars, people have to use buses, people have to use planes because we don't have the same life. So that's what makes it difficult. So in theory, 21 days is all that it would take to stop a pandemic that's killing people, breaking world markets, putting strain on the medical industry, and
all this medical industry. But at the same time, 21 days, a whole 21 days might also break all of those things.
The halt of 21 days will break. Most certainly, half of those things are done for.
Exactly.
Half of those things are done for. How is the hospital going to run if it's 21 days without patients or staff?
And the hospitals is also another scary thing that we're hearing about. Because it's fine, we're hearing that Western Cape, their numbers are looking promising. But the news, I saw on the news that they say the reason that's the case, that it seems like the numbers are stabilizing, is because the Western Cape agreed a long time ago, maybe I think a couple of weeks ago, if not a month, that they're only going to start testing people over 55.
Yeah.
I mean, if you reduce the sample by over half, of course, it's going to seem like a stabilization of some sort.
So they're using, so basically they're saying something like, if I don't know, it means I don't have it.
Yes. It's like them changing the definition of the unemployment rate to reduce the unemployment.
Yeah.
Because that's one of the things that our economics lecturer used to say is like, governments usually reduce unemployment rates by changing the definition of unemployment.
Yeah, and they say something like, there are 15 million people from the age of 14 to 21 that are unemployed. You understand? So when you look at it, there are people who are 14 and there are people 22 who are also unemployed.
But they're not counted.
Yeah, they're not counted. So because they're not counted, they don't fall within the range that we hear.
Because a good example of unemployment, another thing is that, if you are discouraged, like you have the degree and everything, but you just do not want this because they do surveys every year as to find out are you still looking for work? Are you unemployed? Some people just say, yeah, I have my degree, I have everything, but I'm not looking for work, and because I'm discouraged and I give up. Those people are not counted in unemployment. They are unemployed, but that 35% figure.
Yeah, they're willingly unemployed.
They're not willingly unemployed per se, but when they count the percentage of people in the country that do not have a job, because that's what unemployment means, they're not counted. Even though they are technically don't have a job, and you know what I mean. And also, you will a lot of people, too young to old people.
Yeah.
So it can be a similar thing. Yeah, what you might call it.
That's a smart thing to say. They changed definitions in order to hide the two numbers.
No,
Instead of saying there's 50 billion people who are unemployed, you're gonna say 5 million people got retrenched. And then you're gonna say 15 million people are unemployed.
But once there's 15 million people are not looking because they're discouraged, then you're saying actually the number of people unemployed in the country are 30 million or 30 billion, as you say. So
because whether I got retrenched, I have never gotten a job, I quit my job, I graduated but don't have a job. All those categories, I'm unemployed.
Yes.
But you don't categorize it in all those categories.
When you're doing the official numbers, yes, you don't.
You categorize them separate.
And that's one way that the country uses to stabilize the numbers, because if they reflect the true everything, because the people who are not included in unemployment, it's like, for instance, homemakers is, housewives. They're not included in unemployment. They don't work, but they are
included in unemployment.
Exactly. Yeah. And then students are not included in unemployment.
Unemployed? Essentially, unemployment is the number of people we have in the country.
How many are working?
The number of people who are working minus everybody else.
Yes.
That's unemployment.
Some you can argue, like students, you can be like, okay, yeah, you don't include them because
unemployment, you don't have a job. So
no,
whether you're a student or a toddler, you don't have a job.
But then you're working towards trying, you know what I mean? Because another one,
you separate, you divisionalize it, it's no longer unemployment.
But also,
unemployment is somebody who doesn't have a job.
But also, I think that it's what matters also. Why are you revealing the number? Like the intention of the numbers. If the intention is just to say how many people don't have a job, it's one thing. But if you're intending to say how many people who could have a job don't have a job, in order to see how the country is scaling, it's something, because you don't want a lot of other things, like one of the people that are excluded are too young or too old. People from 0 to 10 years old due to 0 to 15, child labor doesn't allow that, and people who are 8 to and above are too old, they might get hurt. You know what I mean? You exclude those ones because even if they did want to work, they are not allowed. Yeah. So you cannot include those ones in numbers. But others, like discouraged workers and homemakers and those ones, you can start being like, but they can't, like, you know what I mean?
They don't have a job. They don't need one. They don't want one. They don't fall within I don't have a job.
They don't want one. So I think it's a similar thing with Western Cape, where it's like, you know what, we're gonna start testing for 55 and above, and
no, like I think they test for if you have severe symptoms, they test whichever age you are, but mainly if you have a cough or whatnot, maybe say it's minor symptoms, they're going to say, okay, let's test you. Because also there's a shortage of tests.
Yes, there's another good point you're making, like to say there's a limitation as to the resources that are used to test.
Also, the report will come and say country A has conducted 13 million coronavirus tests, and then there's another report that says country A now officially has over 1 million positive cases. Understand? That word confirmed that they add there, it has more weight than we think.
Yes.
We don't mind it. We don't look at it.
You know what I realized that?
We think it's for emphasis, light emphasis.
You know what I realized that?
It's heavy.
I realized that when I was watching a report on an earthquake in Japan or Hong Kong or something, where they say, where the reporter saying, yesterday the number of confirmed deaths was 25. Today we are hearing that it's 27 confirmed deaths. So it's like, they really just want to say, oh, we know there's two people. If they cannot count and say and point like those are the two people, by name or by however, if they're not able to confirm without a doubt, they wouldn't put the number down, or they shouldn't.
But here's the thing: the reality is, the day we reach 100,000 confirmed cases could very well be 1,000 days after the country had 100,000 cases.
No, it was.
You understand?
Oh, yes.
Technically, it can't be 1,000 days because we don't know about 1,000 days back then. But what I'm saying is, the day we say we confirmed that there's 1 million people in the country that have it, maybe 2 weeks, 4 weeks, 3 months ago, there was 1 million people only that had it, but we had only confirmed 10,000. Today we have confirmed.
Basically, if they say, besides, of course we know there's a lag. We know that when today the government says the number of total cases in South Africa is, let's say, 100,000, we know that 100,000 is a number of last week or a week and a half before, because of there's a gap between the day they test and the day the results come out and the results are published and the results are audited and stuff like that. But the point is that let's assume that the day they say 100,000 is the actual day they did the testing on the results back. When they say confirmed, it means that if you're to freeze and stop time and then test every single one, you're going to get a higher number. Because that is just those we know of.
Those we know of at that point in time because we have tested.
So if it's like saying once this, I saw a lot of burning houses there, and like how many did you pass by? I'm like, I just saw 1 or 2 there, but I know that feeling.
I just saw 1 or 2, but apparently there's 50.
And I don't want to say there's 50 because I might be exaggerating or whatever.
Also, it might be 500.
But I definitely saw 5.
Thing is, changing something into a percentage just so you don't count each and every specimen is a problem, because you'll never ever get the true inflation. Because there's I don't believe there'd be order in a certain something. Like I said, let's say the batch about the tablets. You take 100 out of 1,000 for testing, and then you find that 99 of those are faulty. And then if you check the other 900 out of 1,000, you do 100. So if you check the other 900, you get that maybe 1 is faulty, but the rest are fine. But because you get your data from the first 10, the first 100 that you took says 90 is faulty, it renders your whole batch null and void. But
there's a thing for that. What's this? It's called population sample. It's basically trying to say, it's like, for instance, it won't be perfect, but we just try to get from a small, like, let's say there's 100 people, 100,000 people in the country, and then we wanna see, okay, what's this? How many people are employed? They weren't gonna interview all 100,000. They're gonna try to take at least like maybe 10 to 20,000 people that represent their whole 100,000. When I say represent, meaning, let's say in the 100,000 people, there are 20,000 white people, 40,000 black people, 20% Indian, or like those different things. In that 20,000, they're gonna try to keep the same balance to represent, like, okay, if you have this kind of mixture, and we ask the questions, if the response is that, we're gonna assume that this can be expanded into the whole 100 thing. So it's just the best way we know of in order to test a whole, and but
so I think but what I was saying is that sampling will always be inaccurate.
It can never be 100%. But if you don't like it, come up with a better way. I think that's what I like about statistics, and bias that it is sometimes. That it's a matter of like that it's the best way. It always tries to find the best way to interpret a big problem in a small way without needing to like.
Pretty much those are the laziest humans on earth.
Yes, it's pretty much because all this the mean, like the average, the median, the 75th percentile. It's all a matter of saying, I don't want to go and ask every single person everything, so I'm gonna make it work somehow and make it make sense. And a lot of times that these type of scenarios and type of techniques is that they've actually tried to do tests where they're able to get 1,000 people and actually interview all of them and then try to get a sample of them into 100 by 100 people or something like that and try to see if the results are similar. And the results are really interesting because you get to see it's not exactly one-to-one match, but they get close. It can be 90% true, 80% true, which is something called the confidence interval, which means if it's 80%, it's too low and we discard it. But if it's 90%, it's close enough that we can say 10% is not enough. You know what I mean? Because it's similar to people don't realize it, but it's similar to medication. The medication, as much as people think like my badge this time is exactly the same as last time, it's maybe off by 0.001% or whatever, but it's not 100%. Just that the difference, the amount of difference is so small that it's acceptable that to call it the same.
Yeah.
You know what I mean? So it's all these rules but yeah,
but that's why they use version like of 100 people tested, 80 of them were negative. Out of every 4 people that we tested, 3 were positive.
And it's also
so then sort of like wavers away from the fact that yes, we haven't tested the whole population, but from what we've tested, this is a pattern.
Yes.
So clearly, if we do the test multiple times, if it's a pattern, it means it's recurring. So chances are, even I counted on the recurring pattern, even on a bigger scale. So if 4 people out of 10 have it, so out of every 10, at least 4 have it. So that's a recurring pattern. So meaning, if you were to say 4,000, that means 400. Would have gotten all 40% of 4,000, which is not 400, it's maybe 400 by 4.
Yeah, which is what is
1,600.
Yeah, 1,600, 1.6.
Yeah, 1.6. So,
if you say 60% of people get it, that means
on a bigger scale, you just
2.4 people would get it if you tested 4,000. If you expand that to 100,000 people, we know 60,000 people will get it and 40 might not have it. So, but then as that is that the longer this goes, the more that 60% starts going to 70.
That's the thing. So it's funny how something as small as a pattern that you learn in primary school, like draw this, right? If you draw 3 lines like this in this pattern, you get a square. You repeat that, you get a square. Something as small as a pattern being taught at a young age, and you look at how big it's impacting the world. Like
a lot of people overlook at a lot of high school things that they taught, and they're using it unconsciously. For instance, for me, one of the big things, this one I'm not using it unconsciously, I use it consciously, but a lot of people always ask, where am I going to use that quadratic formula, the b squared plus or minus square root 2a plus something like I'm even misquoting it, which is very embarrassing. But what's this? Some people will be like, I never use it. And for me, I'm like, I remember there was a test and I'm like, oh yeah, quadratic formula. And what's this? I had to use it, and that was in my second, third year of my university. But also, although that my course didn't require that kind of work, but I'm just saying that for me came through in the end where
the thing is, school is quite tricky. That's a whole different topic on its own.
Yeah.
So the way school is tricky is that you have to teach people such a lot of knowledge so that they see where the strong point is and where they can focus. You teach somebody how to draw, how to color in using the color wheel. You teach somebody how to add. You teach somebody how to balance. Or in grade 9, you learn all these different things, and you need to see that I'm passing accounting more than I'm passing mathematics. Meaning,
maybe
I can then going forward. I can then going forward focus on accounting. But then, if from grade 1, the only thing you ever taught that person was accounting, they will be good at it because it's the only thing they'll ever know.
But the problem with that is that
they won't know if there's something that could be better in.
Exactly.
But then they'll always be, you understand?
And because that's the problem with anything that has to do with skill or technique or whatever, is that you're going to get 10% of people who are extremely killing it, and then a bunch of people who are okay-ish, and then some people are actually terrible at it. And the problem is that you cannot just say everyone do this one thing, because everyone cannot be good at one thing, and the school tries to be variant. The problem is that sometimes people think of school as a singular thing, similar to how we are talking of EMS as accounting as a singular thing. They regard school overall as a singular thing, saying, I'm not good at school, so it's just it might have that you might not be good in certain subjects, but maybe subjects if you you might have a spark or two, and that's what it's trying to achieve. And it's not rare to find someone who's terrible at everything. It isn't. I know some people like that, and that's just a matter of life. Like I said, if anything to do with skill and learning, there's going to be a hierarchy of sorts.
School is an aptitude test to see what you're good at.
Yes.
That's what I would say.
Sometimes it's done incredibly well, where the aptitude test is like they give you a proper form and a good piece of pen, while other people, they're saying draw in the sand with your hand and you cannot even see the symbol for that. There's also those variants where the method of delivery can influence
think about this way. You don't have performance arts in your school, right?
Yes.
But then you have a grade 8 school play, right?
Yes.
And then from a grade 8 school play, you have 80 kids who say, I want to sing. Out of 80 kids, 5 are your best singers, right?
Yeah.
And then these other ones can't sing. But you don't have dramatic arts at school, right?
Yeah. So
the 5 best singers only will find out that they can sing because of the school play. So something as little as a school play that doesn't have any performance arts background at school could then say, okay, after matric, I can actually sing because I remember I could sing in the school play, in the school choir. But it's not dramatic arts. It's not something that you learn. It's something that just you bumped into. All these
and school have to facilitate that.
All these small little things, like a simple connect the dots,
like
picture.
Something simple.
Some people just trace it better than others, and they see that I don't need a connect button. I can trace it, do this, do that, enhance it like this, enhance it like that. And
like something simple for me, chess. Like if I was never in a school that took chess a bit serious and even sent kids to tournaments, I was going to be as good as chess as any other person. But since it kind of facilitated that I was able to learn it, and so that's why there's a lot of different things that schools really. But actually, we digress. And what's this? I guess this is a good point to stop us in.
Yeah,
because
otherwise we'll never stop.
We'll never stop. But hey, boy, again, thank you so much for doing this. We covered a lot of things, and there was so much that we thought we were going to talk about. We didn't even
touch it. That's the thing.
No, but that's the nature of this thing, is that
it's unpredictable.
It's unpredictable, and it's more about the conversation. And thank you so much again.
It's a pleasure. And like I said, most of what I've said, I hope I've disclosed, is from a personal point of view and my own experience. Some of it is from what knowledge that I've accumulated that is out there, but I can also therefore should state for I can never ever be liable for how another person interprets what I say.
Of course.
So just because one person understood me saying short people, and then they see it as me discriminating against tall people when I didn't even say anything about tall people. So I'm not liable for what anybody else thinks of what I said. I said what I
Everyone
said.
is responsible for the way they interpret the information they receive.
Yes, and don't be taking me to court because we're both gonna go there and be like, I know.
Like, of course, there's ways to offend people and there's clearly offensive ways, but also if you really want to be offended, you will find a way. You know what I mean? If you want to feel sad about something, if you want to feel happy about something, if you said deep enough and hard enough, you will find that thing in a particular conversation. So I can see I like to jump and someone's like, oh, walking is not fun.
So I'm just jumping around.
Dude, it's like, they can be mutually exclusive, this thing. They don't have to always be interlinked.
Yeah, so I think, nobody can tell me anything about my life and my experience and how to interpret my own experience.
That's true.
So then I'll forever be responsible for what I say and not what somebody understands.
Yes.
Because they will take it and they will self-inflict it and put themselves in those shoes and see that, no, man, if I won the lotto, not buy a Ferrari. Why does he say he bought a house? He's lying. He didn't win the lotto. They gave him the house. So you understand?
Yeah. And also I think another thing, very important thing is that unless you truly, which you can never do, but unless you truly know that the experiences that someone went through, you also do not know what lens they're interpreting what they're saying through.
Yes.
So what's this? So you have to have an open mind when receiving information. That if I talk about something. Let's say I talk about my the way I don't like black clothes. Maybe as a young kid, I saw ash, something bad, and it really traumatized me, and that hit something unconsciously. I don't like black clothes, and now you don't know that information. Yeah, and then you are caught in this hysteria of all blackness is gold and everything. But my personal experience is that I understand all that, but that's none of my business. I don't care about that because for me, there was this particular experience that changed my way into which I look at the lens of black material or whatever things, or let's say, like some people don't like to swim because they were drowned as a kid. Yeah. And so I'm like, swimming is a skill, everything. Like, nah, yeah, I get all that, but me, when I tried to swim as a kid, I nearly died, and I swore to not touch that thing again. And I'm fine, you know what I mean? So the lens that someone is interpreting it, just keep an open mind that some experiences you don't know what they went through. So, which is also what I'm hoping that people will understand with this podcast going forward, is that if all of a sudden you knew me, Marupin, as a grade 10 year kid. Well, not just 10 years. That doesn't make sense.
No,
a 16-year-old kid in grade 10, and you knew me as this kind of boy and stuff like that, and or this, and then all of a sudden I talk about certain things in a different way that you thought of. It's because maybe between 16 and my 24 years, something might have changed, especially through my varsity years, because I
wasn't there.
Yeah.
So I never went. I never went to varsity. Something we should have talked about.
Something we should have touched on, and
hopefully, as I'm the first. You did say this is episode 1, so if this is episode 1, then
no, you will return, of course.
This I can return, so we'll have structure. So we'll have tell us about scale. Tell us about. I can't break no script. Never, of course. Maybe, something.
No, but what's this? Also, I think, what's this? Like I said, there's still plenty of episodes come. You'll still be invited back, and there's still a lot to talk about because we covered a lot about COVID, but not a lot of other aspects.
I just want to say that I hope that I put into perspective different types of viewpoints to people in terms of COVID and how to approach it and going forward what to do. That it's something that you can live with provided you take all the necessary precautionary measures.
And you're taking as someone who's literally in the front line.
Yeah, in the front line. So that's what I wanted to put out there, that I can't say it's a death sentence, and I can't say it isn't. Because some people with comorbidities are surviving and some aren't. So I can't give a definite this is this and this is that. But if you take the necessary precautionary measures, by all means, you have a greater chance of being alright than not.
Yes.
And I think that's about it.
Yeah,
otherwise,
I think that's a good point.
We'll say goodbye for another hour. We'll spend the hour explaining. No, man, I'm saying goodbye, but I'm saying it like this, like that, and then just adding things.
No, but boy, thank you so much.
It's a pleasure.
Until next time.
I'm glad I came.
Can't wait.
Thank you for having me.
Sure.